and good afternoon, morning, whichever it is. I'm Dr. Deuk, and we are performing a Deuk plasma rhizotomy. This is a rhizotomy procedure to deaden the pain nerves in this patient's neck. She has two problems. One is she has herniated discs, degenerated discs that need a treatment, but she also has facet pain. And the facet pain is a separate problem. Facet pain is basically pain coming from a joint in the back of the neck. These joints are the second most common cause of neck pain. The first being the disc, the second being the facets. So her facet joints are definitely painful based on my exam of her yesterday. And we've recommended that we treat these joints. You can see C2, C3, C4. I can feel the bone where the nerve is, the pain nerve is, and I'm using a probe that generates plasma, and this probe will destroy the nerve to the facet joint that's causing all of her pain. So there's one down shot. It's perfect. I'm going to go north a little bit and get the next one shot. The key here is to make sure you're staying on the bone of the spine. Shot, which I am. I could feel it. Shot. It's not an easy procedure to do, but it's also not as difficult as the laser surgery. Shot. Not every patient needs a rhizotomy, only when they have pain that's coming from their facet joint. Now, what causes that pain? Inflammation. What causes the inflammation? Arthritis. Come on, Jordan. Can you see me looking up? All right. Any questions?
Yes, we have a question from Canes25 on YouTube.
Hello, Canes25. Shot.
Asking, can facet pain travel to the side of the neck and a little interior, also shoulder?
Yes, it can. Facet pain can definitely travel. We call it referred pain, and it's very common for that facet pain to refer to the shoulders. Very common. As a matter of fact, you can look it up on the internet. There are maps that show you where facet pain radiates to or refers to. But it's very common. Shot. The key is to get in just the right spot, which is kind of where I'm at now, which is at the waist of the lateral mass, the waist. Shot. Shot. But yeah, facet pain is very common, and it happens, we've calculated, in about 25% of our patients that come with disc problems, they also have facet problems. I think it's even higher now that we're diagnosing it more commonly. Shot. And the nerve that transmits the pain up to the brain, where you perceive the pain, comes right around the spine, right in this area where we're working. The problem with RFA, radiofrequency ablation, is that it doesn't generate a powerful enough force, electrical force, energy force, to destroy the pain nerve permanently. So the effects are always temporary with RFA. And we use a wanding technique where we actually wand and move our wand, for lack of a better word. We move it to make sure that the pain nerve is cut. Almost done, Sean. Any other questions?
No current questions, but we do have a comment from Sylvia on YouTube.
Sure.
And Sylvia just says, I will need to go to have the same procedure done.
Yes, Sylvia, I recommend we first make a diagnosis, and then once we're sure of your diagnosis, then we can talk about a treatment. But diagnosis always comes first. And the good news is, whatever the cause of your pain is, whatever it is, whether it's the disc or the facet, because it's going to be one or the other, we can fix it. So we just need to figure out which facet joints and which discs need to be fixed. Now we'll be back. We're done. We did this procedure with a 4mm incision, one 4mm incision. And I destroyed the pain nerves on the left side to the C3, 4, 5, 6, 7, T1. So we got the whole left side of the neck. So that horrible pain she had before surgery when she twisted her head and looked over her left shoulder should be gone. And now we're going to treat the discs that are also contributing to pain in the center of her neck and irritation of the nerves that go down her arm. That's next. So we'll be back for the Deuk laser disc repair in about 15 minutes. Thanks, Henry.
No problem.